Hello everyone, back after a quick lunch break. We're here with Meera Radia today, a very good friend and a very good colleague. Meera, thanks so much for your time and for coming to us. Meera owns and has founded Pocket Eye, which is an amazing platform that connects optometrists to ophthalmologists. But I'll let the experts do the talking.
Thank you, Hasnain. Really happy to be on this podcast, and thank you so much. And so, yeah, exactly what you say. So at Pocket Eye, we connect optometrists with ophthalmologists for clinical advice and guidance. So we're a web app that you can access via any device, smartphone, desktop, tablet, and just with a login, you can actually upload as many images as you like, with OCTs or whatever other images you need to upload. There's a live chat function as well, and we provide instantaneous advice and guidance from UK-trained Moorfields ophthalmologists within a few minutes.
Okay.
So if there's any patients who are not sure about what to do with clinically, whether to send them urgently to HES, or whether to refer them routinely, or whether to just discharge them, we can provide that advice and guidance.
What made you do this in the first place?
So I'm an ophthalmologist by background. I'm based at Moorfields Eye Hospital, and I was seeing a large influx of these WhatsApp groups, which aren't necessarily legal or above board, with large groups of optometrists and ophthalmologists in these groups, mostly for financial interest for ophthalmologists, whereby optometrists would just send pictures of patients' eyes or OCTs for advice and informal advice and guidance. And there's several problems with this. They're not GDPR secure. They're not an NHS accredited way of referring patients, and patient confidentiality is obviously could be breached in these ways. So yeah.
How do you intend on spreading the word to optometrists? Because essentially it has to come from the testing room to the ophthalmologist.
That's a very good point. So at the moment we have, just through word of mouth, we have over 400 optometrists in the UK who've signed up to use our free of charge platform. So we're running a 1-year free of charge pilot scheme, which we're likely to extend as well. As well as conferences like here, 100% Optical, also speaking to highly skilled professionals like yourself and your amazing work that you're doing here, and just getting our word out there through speaking to people in the community.
And what stands you out from your competitors?
We're really clinically focused. We're really there to care after the patient. We put the patient first over any financial interest. We're here to really help give feedback to optometrists who need more training with OCTs. The other thing I forgot to mention is we're also CPD registered, so we're planning to launch some CPD events this year. So that's one thing that we differentiates us. We also provide rapid advice, so where as an optometrist you might be hanging on the phone for a very, very long time trying to get through to the NHS hospital. We're digital, we're digitized, and we're very light and streamlined. So it takes 2 to 3 minutes to fill out a referral, and send the referral, and you'll get a response.
Via the app.
Or via the app, and then you'll get a response within 15 minutes. So
I think it's great that you're doing this, because I feel that optometry has stagnated over the last 15 years.
Really?
It hasn't really moved with the times, especially with technology.
Yeah.
And it's great that someone like you is taking advantage of the new technology that's available to connect different parts of optometry together. And I feel that optometrists, ophthalmologists, whatever part of optometry you work in, everyone is quite fragmented.
Yes.
And they work in their own little area. They're amazing, but they're not able to connect with an optometrist, or a behavioral optometrist, or a consultant. And if we can all work together somehow, it's going to improve the efficiency of the whole system, reduce the burden on the NHS, support optometrists who sometimes don't come across a certain condition. It's not our fault sometimes, because we don't see a certain condition in every 5 years. Eventually when it pops up, we're like, what do I do? And I've been in that situation myself. And suddenly you find yourself Googling. And if there was a system like this, it would be so useful, but more so to the patient. And I like how you said that your aim is for the patient to be happy, and for the best course of treatment for the patient. Because if it works for the patient, it will nearly always work for everyone else as well.
Very wise words. And building on that, from our pilot, we found out of every 100 referrals sent, 65 referrals or patients were prevented from a trip to the hospital just through our app platform. And then the other thing is we were saving the optometrists around 15 to 20 minutes of clinical time, because a lot of the ones who piloted with us normally have to telephone the eye unit and ask for advice, whereas through our app they were saving around 15 minutes per referral sent.
And they can actually see someone else in that time.
Yeah,
and
exactly.
It reduces the burden on the NHS massively.
Yeah.
That 65% of people who actually didn't need to be there would have been there otherwise.
Yeah.
So what's the current state of the situation? It's a lot of money.
Inundated. Exactly. So,
where do you see this going in the future? 5 years time?
Massive ambitions for Pocket Eye. We would love to see it adopted by all optometrists in the UK. Obviously, it's very, very ambitious, but we'd love to be able to get there. We'd love to also start automating some of these responses through building algorithms that can actually detect and give advice and triage eye conditions for the optometrists. We'd like to be incorporated into, working with all a lot of the associations, AOP, for example, AIO, for example, as well, and LOXUS.
Yeah.
So that's kind
I think if you get the buy-in from the organisations and the regulators higher up, you're more than likely to succeed in this. And I think if you make the app as simple as possible for optometrists, see, a lot of optometrists are now in their 50s, in their 60s, and they're set in their ways. So sometimes bringing something new out to the industry might be the best thing, but it's not the easiest to implement. So I guess it just has to be as simple and user-friendly as possible. Just so that you get maximum output out of it.
Exactly.
It's not having a great service that half the population doesn't know how to use.
Yes, exactly. What we've seen is a lot of people now in their 50s, 60s all have smartphones and are becoming very adept at using smartphones. And when you look at the younger end of the spectrum, the pre-reg optometrists who are just graduating...
You should be teaching them on TikTok now, isn't it?
Exactly. They are very keen to use Pocket Eye, the pre-reg or newly becoming pre-reg optometrists, because this is something that really supports them.
I think it should be given at university stage as well.
Yes,
because I think the way that they teach at universities needs to change. I don't feel it's come with the times. And I feel that they have a curriculum and it's not really applicable to this day and age. Because in 5 years' time, I don't think optometrists are going to be refracting. I think the machine's going to be doing that. And I think that's going to be done virtually. And it's already started.
With there's a few companies out there
already. But what won't be replaced is a clinical aspect of optometry. And things like this, where the optometrist is needed to diagnose and manage conditions. And that's where the future is, in my opinion. And if the optometrist doesn't move towards that, eventually the optometrist will fade away. And any apprentice will be able to do a refraction.
You're right, there is a lot of innovation in the refractive side of optometry, but less so the clinical side, I guess, apart from imaging. But you raise a very important point.
On a separate note, as a consultant, as Moorfields, you have a breadth of vast knowledge. How do you think optometrists should be improving their ways in order to help people like you manage patients more effectively? Is more training needed for the optometrist? Does optometrists need to educate themselves more, even beyond the standard CPD points? How can we help?
Well, I think it's not, the onus shouldn't be on one professional body in particular. I think we have shared care. We share the care of that one patient's journey from primary to secondary eye care. So the onus is on everyone to share that responsibility of training up, improving OCT recognition and diagnosis in primary eye care, and in secondary eye care, how can we support primary eye care better, and vice versa. So I think comes to training, education is always the best place and the first place to start with. And then I think communication follows on after that. So how do we communicate better between primary and secondary, because it's so fragmented and it's very analogue at the moment between NHS and optometry practice. So
in Pocket Eye, are you thinking of a way to also educate optometrists?
Yeah, exactly. So we are CPD registered with GOC. We are launching our CPD events this year. They're going to be clinical focused, looking at things. So we're getting a lot of feedback from our market, from our optometrist market. So saying what they're looking for. So that's OCT, education on OCT, macular scans, visual fields, things like that. So we'll be doing some education events.
Because I think it's important to improve the education, as well as the efficiency of referrals, obviously, as well. Because I don't think it would be of any benefit clinically or educationally if an optometrist was to be told, okay, refer him within a week. But what's the context behind that? How do I, as an optometrist, learn why what you're as an ophthalmologist is telling me to do.
Yeah.
I'll follow your instructions. I also want to learn, why.
Yeah, there's a big shift towards clinical from primary eye care. Look at the birth of MECs, Qs, things like that. So, it's heading that way.
Fantastic. Amazing. Well, look, I wish you all the best with Pocket Eye.
Thank you
It
so much.
sounds absolutely amazing.
Thank you.
And I hope it really, really flies because it'll be a benefit to everyone involved, but ultimately the patient.
Yes. Oh, thank
all right.
you, Hazard.
Thank you very much for your time.
Yeah.